Gauteng hospitals are under pressure as the province experiences a rapid rise in COVID-19 infections. The provincial government says it's well prepared for a third wave, despite the prolonged closure of Johannesburg's Charlotte Maxeke Academic Hospital. While joining us now to outline the province's view on how hospital capacity, Gauteng's Chief Director for District Health Services, Maxeke. Good evening to you, and thank you so much for your time. Firstly, when we look at the fact that the Charlotte Maxeke Academic Hospital is not going to become available anytime soon, how much capacity has it taken away from the province in terms of our response to COVID-19?
Good evening, Kathy and the viewers. Charlotte Maxeke Hospital, it had COVID dedicated beds that were about 800. However, we need to indicate that whilst those beds are not available, as a department, we have made other beds available. And I think you are aware by now that when we talk about COVID beds, we talk about what we have in the public sector and what we have in private. And I think it's important to indicate that as a province, we have over 9,000 available beds when we include those in the public sector, in the private sector. In the public sector, as Gauteng, we have just under 4,000 beds now. It's 3,840 beds that we have made available. We have increased these beds by 1,112 beds now, as we noted the increasing numbers of new COVID cases. So at the moment, the number of beds that we have against the admissions that we have currently, as a province, we are doing well, and we think that we have adequate capacity for the anticipated increasing numbers that we're looking forward to in the coming weeks.
Of course, the challenge is not just about having enough beds available, but it's also having beds available where people need them.
Yes, Kathy, the beds are available across the 5 districts in Gauteng. We have COVID beds in all those districts. And of course, we know that in terms of higher levels of care, then those patients that are in a very critical condition would then be going to the higher level hospitals. But ordinary high care is available in all the 5 districts of Gauteng. And it is important for our communities to note that we have those beds, but we're also appealing to them. I think it's important to state that one of the challenges that we're having in this province of Gauteng is the high trauma cases that go to our hospitals. It's important for community to play its role to reduce those trauma cases so that we don't have them taking up these beds that would become so necessary now to manage the COVID infections as we're seeing them increasing day by day.
Of course, part of the sentiment that has been shared, and just looking at some of what your colleagues also within the Gauteng department have said, in particular, Thabo Masebe, who's the provincial spokesperson, saying to a local radio station this morning that that the province is running out of capacity for beds in hospitals.
The current admissions that we have as a province, as at yesterday, it was 3,859. And I've indicated that for both public and private, we have over 9,000 beds. And the 3,859 is both private and public. In the public sector, we had 994 admissions, and that is against the 3,840 beds. And I think it's important to continue promoting that message that our capacity is really being occupied, and let us decrease these numbers. The first thing is people should really make sure that they reduce their movements, because in our movements, we're taking this virus from one place to the other. In our movements, we find ourselves not adhering to the prevention measures that we know we need to adhere to. And that is a problem that we're having. And it's important that our community is aware of that.
Why is it taking so long to fix the Charlotte Maxeke Academic Hospital?
As you know and understand, in any building construction, or as in the case of Charlotte, following the fire that we had, we need to have compliance certificates at that level before we can occupy the premises, to make sure that when the premises are occupied, they are indeed safe. So at this moment, we are still awaiting the City of Johannesburg to finalize in terms of their accreditation, their compliance certificate for occupation.
We're also dealing here with a situation where the country is experiencing higher levels of load shedding, or at least that's what it feels like in terms of the blackouts we've had within the past couple of weeks. How is that affecting the functioning and the running of the hospitals? Do you anticipate that it's going to have an impact, in particular on those hospitals, should you need to build some field hospitals and also find yourself having people who are relying on oxygen tanks?
Well, let me start by indicating that as a province at this stage, we're not talking on the creation of field hospitals. And I think you remember that we had Newzroom Hospital, and Newzroom had 1,000 beds, and we were never able to fill it. In fact, it never went beyond half its capacity. So as a province, what we are doing now is looking at the hospitals that we are having and increasing capacity as far as possible in those hospitals. But in addition to that, you are aware that we are now having the Anglo-Ashanti Hospital in Carltonville. That is also the added capacity that we are having. We have also built additional beds at Chris Hanibara, at Bronkhorstspruit, and in other hospitals as well. So in this way, the capacity that has been built is going to remain available for the hospital to use it even beyond the COVID times. And with regard to the issue of load shedding, it's definitely a challenge. However, let me assure you that all our hospitals have generator backup, and we ensure that those generators are checked every day to make sure that they are functional, so that when there's load shedding, the hospitals can continue functioning. However, it will really make life easy for everyone if we did not have the load shedding.
And water?
The issue of water, we have been experiencing it, as you know, in some parts of Johannesburg in particular, and also backup systems. The two hospitals that were affected, they have had boreholes that were being dug in their premises to make sure that they have that backup system. Other hospitals do have boreholes, and those that do not have boreholes yet, they have their water tanks that they use when there's a challenge. And I have to indicate that we have seen this particularly in Sidibeng, where as we had challenges with regard to water, the municipality did exactly what was done also in Johannesburg, bringing the water tanks to try and provide the water system. But again, the best system is when there's water available at all times. And that's what the two municipalities are trying to do to make sure that we don't continue to have those challenges.
Ms. Lefruka, before I let you go, why has it taken private actors to dig boreholes at government hospitals? Why were government officials not the ones on site digging up those boreholes? Because ultimately the responsibility of the provision of that kind of service still lies with government.
Indeed, we were supposed to have seen that way in advance. Unfortunately, it is not all our hospitals at the stage that have boreholes. And of course, gift of the givers, given the fact that their procurement processes are so easy, it was easier for them to chip in and provide that level of support, and it's highly appreciated. And as the department, it is our duty now to ensure that we create that level of backup system. But of course, you know that in government, we first have to make sure that those things are budgeted for, and there's procurement process that is followed. So it would really not be a situation of we come up with that today and the same day we start digging, because unfortunately there are processes that need to be followed.
But we've heard of all sorts of emergency deviations for different kind of work, some of which becomes questionable, other kind of work even makes it into national headlines. So it's interesting to me that you're saying in a situation where hospitals do not have water, it's easier for somebody who is not government to be able to intervene, whereas government is caught up in red tape.
Kathy, gift of the givers moved very fast, and as government, indeed, there's always emergency procurement, but the speed at which the gift of the givers moved even surpassed what could have been the situation even with that emergency procurement. Because yes, it is an emergency procurement, but it would still need to meet certain standards.
So I suppose what I'm asking is, why can't government move that quickly? Why is the risk of lives being lost not an urgent thing for government to respond as quickly to it as we saw, perhaps, the kind of response that Gift of the Givers had?
We really hear what you are raising is an important point, and we are continuously improving in terms of how we're responding to issues. And in this particular instance, it was really unfortunate that we did not have that backup existing already, and we had that situation. It was not anticipated. And going forward, as I've indicated, that as government, we are now in a process of looking at our facilities to say which are the ones that do not have the backup, and look at how best to ensure that we have that in place before we have those challenges in case they come in the future.
Does that include an audit of the fire extinguishers as well?
Yes, fire extinguishers are part and parcel of the audit that is done in any hospital. And just the same way that generators are checked on a daily basis, the same thing goes with fire extinguishers. We have a system of ensuring that there's a firm that comes on a regular basis to come and check in terms of the functionality of that particular system.
Are you able to confirm that the fire extinguishers at all Gauteng hospitals do actually work? Because we know that it wasn't necessarily the case for the Charlotte Maxeke Academic Hospital.
In terms of the reports that we have at our disposal at the stage, we are not aware of any fire extinguishers that are not working. And remember, that is part of the responsibility of the relevant manager in that particular field to ensure that those fire extinguishers are working at all times. And that's what we strive for. It's a standard that we promote. It should be upheld in all institutions at all times.
Gauteng Chief Director for District Health Services, Macy Lerutla, let me thank you for your time tonight on The Pulse.